So again, a very warm welcome to this Q&A webinar with David and Mandy. We're going to go deep into healthy soils, healthy food, food as medicine, and the human health and regenerative agriculture Nexus, which is a way better title than I could have come up with. And I'm very happy to see you all here. It's been a while since we did a Q&A, so I'm very happy to do that. I will do a very short screen share, basically showing a bit what the background is of this podcast, where you are, in case you just found this somewhere on LinkedIn and are wondering, where am I? What am I listening to? And what is the background here? So again, welcome here. We are running the podcast Investing in Regenerative Agriculture and Food, which we've been doing. And this is the Q&A with Mandy and David on the nexus between human health and soil health from field to body. We've done over 150 interviews now. It's keep going. Like we did, I think 40 or so this year, and with investors, farmers, scientists, fund managers, and so much more. Always asking the question how to put money to work to regenerate soil at scale while regenerating people, local communities, and ecosystems, and generating a fair return. We've had many very interesting interviews this year, not so many Q&A webinars, so we're definitely trying to speed it up next year. You can find it in your favorite podcast app. If you haven't been listening, just search for Investing in Regenerative Agriculture and you should see us. We also run a video course, which is pay what you think it's worth. So if you're more into video and less into audio, you can find that on Investing in Regenerative Agriculture, simply the website.com/course. And you can also find it on YouTube. And so what is regenerative agriculture? Probably get that question the most. It's very tricky to find a definition simply because it's a journey. But just to find a sort of common ground, I find this one quite interesting. It's a system of farming principles that increases biodiversity, enriches soils, improves watersheds, and enhances ecosystem services. We can have an endless debate in Q&A just about this, which we're not going to do. But I think the key crucial words here are increasing and enriching and improving and enhancing, which sort of suggests that it's never done. And there's another, let's say, visual way to see that, which is you can look at extractive, regenerative, sustainable, and regenerative on top of that. But I think the best one is this visual one of Ethan Solovyev, which comes from a great article he wrote already 5 years ago on degenerative versus regenerative. And just you can probably put every farm, every watershed, every ecosystem on somewhere on these lines. And it's a set of practices which comes down to covering soil, complex rotations in place and time, very limited or no tilling. There's a lot of discussion about that obviously as well. And in many cases, integration of animals, which is heavily discussed as well. In this case, we can probably add a few more practices here. It could be agroforestry, into introduction of trees, etc. But I think we can summarize them all by they're building soil, and that's what we're trying to measure as well when we try to measure regenerative agriculture. If you want to learn more, there's a lot of online content, not just a podcast. I already mentioned the article by Ethan Solovyev, the Regen Agriculture Continuum. There are quite a few books. There are quite a few documentaries. There are quite a few YouTube channels. And so if you want to go deep, this is your chance to go deep. And definitely reach out to me if you have any other questions. Put things in the chat that are great ways to get started. And now we're going to go back to Mandy and David, who are already online. And let me also add to the people that are in the waiting room, sadly waiting for us. And I'm going to hand it over to David and Mandy. David, we got to know each other, I think, at the Soil Wealth report you wrote a few years ago. And we did a brief interview at the Oakland conference 2 years ago.
At RFSI in person.
We met in person and we did a brief interview after the conference, I think, which was a lot of fun. And the Soil Wealth report, I will put it in the chat as well, is still a wealth of knowledge. I hope you're going to do an update at some point to see mostly in the US context what is investable, what is investing in the space in terms of agriculture. And it's been a very interesting insight of what's happening in that space. And now you took it to a whole new level together with Mandy in terms of food and health. So I would love to do a short intro of the report you wrote, the white paper you wrote together, and then we can go into the Q&A. So please take it away. What have you learned over the last year and a half? I think you were writing this.
Yeah, excellent. Thank you so much. Well, we are thrilled to be with you all today. It looks like there's folks joining from all over the world. So this will be a wonderful conversation. So we'll start off just by telling you a little bit about ourselves and then run through a few slides to give you an idea of what the paper is about. But as we're talking, if you want to go to the link on your screen, we can also put it in the chat. David, could you toss it in the chat for folks? So if they want to pull that up while they're listening. So I am Mandy Ellerton. I'm based in Minnesota in the United States. That's for those of you who don't know every nook and cranny in the United States, that's in north central part of the country, closer to Canada. My background's actually in philanthropy, and I worked at a private foundation here in the Minneapolis-St. Paul area for a number of years, worked on impact investing there, integrated capital. A few years ago, had the opportunity to do the Integrated Capital Institute Fellowship through RSF Social Finance, which was how I met David. He'll talk a little bit about our origin story in a bit. But prior to philanthropy, my background is in grassroots organizing and social work. So I come at this from perspective of the dignity and worth of human beings and how to optimize their health and what systems and structures lead to people's suffering and how we can go about bringing about systems transformation. So I'm not a scientist, but I love and appreciate science. And that felt like the right place to start for this work, which David will talk about in a little bit. I think my personal passion about these issues has to do with my own personal health journey and struggles with chronic illness, and finding that food was the key to my healing and wellness. And so that's why I have become so passionate about these issues. So David, tell us about you.
Good morning or afternoon, David LeZaks. I'm a senior fellow at Croatan Institute. We're a nonprofit based in Durham, North Carolina that works on building social equity and ecological resilience by leveraging finance to create pathways to a just economy. And my journey to here and to what we're talking about today and through the Soil Wealth Report, as Koen mentioned, is from a background in the sciences and a PhD in environmental science, and have kind of made my way into these kind of big questions around how do we leverage finance and investment and impact investment toward building more sustainable and regenerative agricultural systems. And as Mandy started to mention, this paper and this work that we're doing, I think, comes from a very familiar place for this audience and for those who have listened to other investing in regenerative agriculture podcasts. In that in 2018 and 2019, Mandy and I and 23 others were chosen as the second cohort of the RSF Social Finances Integrated Capital Institute, which has recently graduated out of RSF to become the Just Economy Institute. Check it out, definitely. And we were on a journey for around 9 months as a cohort together, learning about integrated capital or ways to use capital to create both social and environmental positive outcomes in addition to financial outcomes. And our first intensive kind of time together was at Piscina's Ranch. Sally Calhoun, who, if you want to learn more about her, tune into episode 9 on the podcast. And we were on a walk with Sally. It was, I think, our first or second day as part of this Integrated Capital Institute. And it was Mandy and myself and Sally, and Mandy was talking about gut health and the microbiome, and I was talking about soil health and the microbiome. And we realized at that moment that we were really just talking about two sides of the same coin. And as part of what we did through this experience of this institute is we ended up designing a $100 million strategy around investing in the transformation of agricultural and health systems with a focus on the microbiome. And this was the beginning to what came out as this paper and this broader body of work about how do we create strategies, how do we move capital, and how do we create movements that are going to really bring these two silos of agriculture and human health closer together. And we looked and looked and looked, and we didn't see, first of all, a strategy that had been designed like that, and second, the underlying resources from a scientific perspective, from a just pulling these various bodies of work together. And that's why with the support of Basil's Harvest, we're able to pull these resources together and put this paper out. So this is kind of the first step in this journey that has been released, and excited to kind of build on this and take it to the next level. So we're gonna in the paper we introduced a couple of different kind of conceptual frameworks to really get the reader and get this conversation going. And the first one we actually developed with Eric Jackson. That would be episode 35. If you're following along,
who's on the call
podcast,
actually?
he's on the call too. Yes, Eric will probably speak up and ask hard questions. Hi, Eric. Good morning. Also calling from Minneapolis area. And we looked at these 4 levels of nutritional interventions. The first one being replacement. If you go from eating fast food, ultra processed, to things like CSA prescription boxes, that is one way to kind of change what's going into your body and how it's grown, and from how it's grown to what's going into your body. Level 2 being free from chemical and drug inputs, whether that's organic or other forms of agriculture. Level 3, differentiated nutrient density. We know that a carrot is not a carrot is not a carrot, or a steak is not a steak is not a steak. And that the way in which we do agriculture, the way in which we tend to our soils, and the way that those nutrients and other things get to our body is actually different. We can't assume otherwise at this point. And then level 4 is this microbiome centric, is that we know that there is a whole wealth of activities happening within the soil microbiome, in the gut microbiome. We know that there's relationships between these two, and now I think we have the questions of, what do we do about it? How do we work towards these actions and these outcomes that we're striving for from a planetary and human health perspective? And knowing that most of what's going on now is kind of at this level 1, level 2 area, and we realize that the investment, both impact investment, philanthropic investment, government investment, is at this level 3 and level 4 area, and that's where some of the work we're tracking closely and are really interested in.
Great. So we also noticed in conversations about these connections between agriculture practices and human health that people were often glossing over what we believe to be the true complexity and dynamism of that journey from the field to the human body. So we first, when we embarked on this exploration of the evidence, we started by mapping out, well, what are the main stops along the way, or what does that journey look like from field to human body, and how might we characterize that? So we created these rough categories to depict that journey and then explore the evidence in each of those categories. So the first is, what are we even talking about when we say more nutritious food? What are the characteristics of more nutritious food? How is food harvested and processed, and how might that harvesting and processing affect the nutrient qualities of food? Then the big category of purchase, access, and preparation. So how do folks get their hands on that food? How do they prepare it so that they can eat it? Because that has a lot to do with the nutritional qualities of food and the ability of someone to actually eat it and digest it. And then the next stage is that question of digestion and absorption. So once someone eats the food, what happens in the body that allows the body to unlock those nutrients and absorb them and utilize them? And then ultimately human health. the final destination of this conversation, human health. What does human health, human thriving actually look like? And what do we know about the nutrients that are critical for a human to thrive? So as we were looking at that evidence, we actually came to understand the journey is bidirectional. So you'll see those two different arrows. And so a lot of times, especially in regenerative agriculture circles, we talk about the journey from field to human body. So the nutrient-dense food making its way from the field to the person. But just as important is whether or not the person is primed to accept and assimilate those nutrients. So what is the state of their body and their ability to take in those nutrients? It's absolutely critical. And so if you've looked at our paper, you can see that we spent a lot of time talking about that. You know, in a minute, we'll get into the broader conversation, but we'll just say that it was challenging for us to find the right scope for this paper and even the conversation today. We want to be clear that we did not delve into the very important conversation about management practices that influence nutritional qualities of food. We think that there are plenty of really great organizations that are talking about that and exploring that evidence. So we wanted to start at the point when the nutritious food has been grown and look at those qualities. So we'll be happy to, there's tons and tons of detail in the paper about each of these categories, and we'd be more than happy to delve into those details as we go along, but we just wanted to give you a flavor for what the paper says. And really the next important point that we want to make, our biggest takeaway is that after looking at the evidence, next slide, please, David. Looking at the evidence, we do believe that growing more nutritious food influences human health. We think that all the leaders and organizations that are talking about this, they are correct. There is a human health dimension to all of this. And we hope that as conversations about regenerative agriculture grow and become even more sophisticated, that we will begin to attract more healthcare-oriented money into the regenerative agriculture space, have healthcare outcomes as a goal of this transition into regenerative agriculture. It's all connected. It's all part of this question of how we do our agriculture and steward land. But we will say in the next slide that although there are these connections, the connections are infinitely complex and dynamic. It's not enough in our minds to just grow maximally nutritious food. Ultimately, it needs to get into human hands, and ultimately it needs to get even beyond the human hands into the human belly and absorbed into the rest of the body. It's a long, complex, dynamic journey, and to ultimately be successful in impacting human health, we need to embrace that complexity and dynamism and talk about that whole journey as a movement. So you'll see in our paper, there's a real call at the end of the paper to say, we need to incorporate all these different systems into the broader conversation and movement. So I'll hand things over to David for a bit to talk about some reflections even after we've completed the paper.
So I think we started working on this paper last January. Took about 9 months to get it researched, written, and out the door. And as complete perhaps as it was, we also realized how incomplete it was and how many rocks we turned over and weren't able to really integrate fully into the paper, but are also really important that in ways that inform this entire conversation. So a couple of those include the various social and commercial determinants of health, the role of inequality in both food access and access and accessibility, and the ways in which people relate to and have a relationship with their food, and how that is not just it's at a personal level, it's at a household level, at a community and a societal level. And when we start to look at commercial determinants of health in particular, and for those who I think that concept is slightly less known as social determinants of health, but strategies and approaches used by the private sector to promote products and choices that may be detrimental to health is how that has been defined, one of the definitions. In looking at how both social and commercial determinants of health add to the exposome, one of these other kind of newish topics out there about the accumulation of everything that a human has been exposed to over the course of life. So we realize that food is not the only thing that determines whether you have positive or negative health outcomes, but it's the chemical burden, it's stress, it's sleep, it's your genetics, it's the genetics of your parents, and all of these things really add to kind of what the exposome is, or how, the aggregate of these exposures, and thinking about how agriculture is central but not the only thing in that, and how we frame in the future agriculture as it relates to strategies, as it relates to investments, as it relates to moving capital in ways to make especially agriculture and food not be a burden on health, but a way to actually add to healing, if anything. And I think that as we have been reflecting more on the paper and reflecting on where and how this paper fits in the work that Mandy and I have been doing as it relates to capital and moving capital, is that we see the conversation around agriculture and regenerative agriculture and investing as a way to begin to reimagine capitalism. It's very hard to fault the current actors in the space, especially those who have commercial determinants of health, whose products and whose profits lead to negative health outcomes, is that in many cases they're playing by the rules of the game, and that game being today's flavor of capitalism. And when we think about how we not only change the rules of the game, but we can use impact investing, we can use other forms of catalytic capital to begin to show what a different kind of economy and economic framework might look like, where we can use food as a tool for healing, and the transactions and the economic activity are in and around food as a baseline, as a framework for what a new kind of economic structure looks like. So, very narrowly focused, yep, this is about regenerative agriculture and food and health, and peeling back the layers of the onions of why are we doing this, what is the end goal here. Yes, it's about the earth and the people and the animals and everything else that lives here, but also how, what does that relationship look like in a way that might be better for all involved. And that's something that clearly we're thinking about. Can't say that we have many answers to, or a few answers, plenty of ideas, but again, things to test out. And how do we test these things? I think this is where these strategies around impact investing and investing in regenerative agriculture can help to test out what these new models look like. And so I think to just wrap up this section, or to start to wrap up, is that if anything that we know, and again, coming from a science background, it's always a little hard for me to say, but yay, we can do more science, we need to figure out more things, but we know enough to act. We know that there are these relationships between how we manage our landscapes and manage agriculture, and that through the use of capital, through the use of individual choice and action, through government, we know that there are levers to pull and ways to change, that we can create a more positive relationship between these pieces of these systems. We must remember that the absence of evidence is not evidence of absence. There's plenty of undiscovered and things that we haven't looked at, but that doesn't mean that those relationships aren't there. Some of them are knowable, some of them are not knowable, but we know that there's, from an inequality perspective, from an aggregation of capital perspective, we just know that it's time to start accelerating these transitions, accelerating the flows of capital in places and spaces that whose outcomes are more than just financial, because we've seen over the last 150 years-ish that just focusing on those metrics is insufficient for getting us through the 21st century. And I think that's, one of the things to look at more closely is, how, what is the makeup of the system? What is the design of how we relate to agriculture? And how do we get communities like this one to really begin to act in a way that's going to be in the best interest of not only the biology and the ecology of on the environmental side, but also for the people who live here. Back to Mandy to point to some examples, especially in places where we've seen or there's actively capital flowing in this transition to a more regenerative agriculture.
Excellent. So this is an investment community, folks who are thinking about how to use capital to bring about change in their communities, change in regenerative agriculture in particular. And so we have been thinking about a follow-up to this paper, whether it's another paper or conversations, but we want to shift into talking about how do we move capital to bring about these changes. And so we want to plant some seeds with you all about what investing in this change might look like. So we just have a few examples here, but would love to hear your ideas as well. I see in the chat, there's a little bit of a discussion too about what it means to invest in regenerative agriculture. So for us, there's if this is roughly following a bit of the journey from field to human, things that we think about is the massive amount of capital needed to help farmers transition into doing these practices. So there's the question of land access, but also financing for inputs and equipment. There's also a new supply chain infrastructure that needs to be built or enhanced. There's lots of supply chain conversations happening, I know, in the United States and globally right now related to the pandemic, but supply chains are a big part of what will allow regenerative agriculture to be successful. Also processing infrastructure as well. Then there's the question of getting those foods out to consumers. So aligned food companies that are processing these foods in a way that maximizes their nutrition. And then grocery retail infrastructure, what we call access infrastructure. So the kinds of infrastructure that allow all kinds of people, no matter their income, no matter their geography, to access and be able to purchase this food. And then if you start to look at human health, there's a lot of room to better understand human dysbiosis. So gut problems would be the shorthand for that. So how do we better diagnose people and understand what's going on in their bodies? And then what are the kinds of rebiosis interventions and treatments? We're still just scratching the surface. We know that gut health is very important to human health. We don't always know how to heal the human gut after it's been damaged. So there's a lot more work that needs to be done. And there may be some really interesting technologies there as well. But we also think about a new healthcare system that actually would prioritize food, prioritize gut health in medical practices. So is there financing possible for healthcare clinics and practices? Health insurance startups that think about financing, supporting practices that center food and nutrition, and even how do we support medical students and physicians through medical school in ways that allow them to learn more about the centrality of food, nutrition, agriculture. So those are some of our initial ideas. We'd love to hear some of your ideas as well. We have not yet studied the economics of each of these ideas. We just know that there is opportunity here. So we are not advocating, we're not saying go out and write a check to some of these ideas.
This is not investment advice, just
yes,
clearly,
exactly,
yeah.
Not investment advice at all. And we would also say that if you are more interested in the realm of philanthropy, so non-return seeking capital, there is even more ideas that we could throw out there for you to think about. These are really things where we can imagine more return seeking capital being appropriate. So I think that's plenty of upfront discussion about our paper and initial ideas, and we can open it up.
Follow-up ideas as well. I was very happy to learn about that. So thank you so much. If you could stop sharing so we can open up the screen and we can see everyone. I already saw some questions in the chat. Some people were answering, so thank you so much for that. If you have other questions, please put it in the chat or raise your hand, which is under the reactions button in your Zoom. We'll definitely post this replay on the website. So if you have to drop off, if you cannot interact now, etc., you want to follow up, we'll put it on our website and on YouTube, etc. So you can watch it at your own speed. If you have any questions, I have a whole list, obviously, but I want to give the space. That's why we do this Q&A to others. So you can either raise your hand, which should bring you up immediately, or type it in the chat, and we can either ask David or Mandy or Eric or anybody else, obviously, on this call for that. So we'll give some space for that. Otherwise, I will ask one.
David, did you see that question there from Diane about the peer-reviewed research?
That's a good one. Yeah, let's take that one first.
You want to touch on that and how we thought about the research that's there?
Now, is there much peer-reviewed research on nutrition in regenerative farmed food? And I asked, do you mean the level of nutrients? And she said yes.
Really good question, and one that we if you look at the 250 plus citations that we included in the back of the paper, a good chunk of them were pointing at studies that that looked at that in one way or the other. There's been a pretty heavy emphasis on organic versus conventional over the past couple of years, decade or so, maybe 15 years. And actually just last week, David Montgomery led a paper with his wife as kind of a part of the follow-up to the next book that they will be releasing sometime in 2022.
Are we sure it's going to be 2022? Because I've been waiting for it for so long.
On a webpage with a date. I'll put the link in the chat.
We need to get David back on the show.
It's time to schedule that one in advance. But this is the peer-reviewed paper that looked at kind of a meta-analysis of those studies. So that was this is last week, clearly after the paper was published. But I think and the big question that he asked in that review and that they pointed out to was, and Mandy said this exact same thing. What are we talking about when we talk about nutrition? Are we talking about macronutrients? Are we talking about micronutrients? Are we talking about bioactive chemicals like antioxidants and phytochemicals? And it seems that, and we came to the same conclusion through our analysis, is that the macro and micronutrients don't matter as much, or we haven't seen as much change in them. And as it relates to health outcomes and health function, they also potentially don't matter as much. There's a great, I'll call it an expose by The Economist a couple of years ago called "The Death of the Calorie," if that paints a picture of that side of it. And it's really a more focus on what isn't on the food label. Depending on where you are, we have different things on our food labels, but the compounds that have a relationship to health are not the ones that we're counting and not the ones we're measuring and not the ones that are part of how we're talking about food and agriculture. So, but what the science has found is that when we're managing our soils, when we're keeping these fungal networks and the microbiome healthy in the soils, they are the plants are producing more of these compounds. They're stressed enough that they are activating the plant defense systems, and that is then it's those compounds that we eat or the animals eat that then we eat, and those are the compounds that have been shown to have positive health outcomes. So that seems pretty robustly studied in the literature that I've seen.
Great, yeah. I recommended exploring nutritional. Yeah, I was going to ask that, Erin. That's a very good one. Nutritional dark matter. I saw it in the paper. It sounds very spooky. What is nutritional dark matter?
I was going to mention that too. And by the way, hi, Erin. Erin commissioned this paper, Basil's Harvest. So awesome to have you on the call as well. So nutrition, I was going to mention, David was talking about what we know about nutrients in food. There's actually thousands of compounds in food that we know are there, but we have not defined them yet. And so they may or may not matter to human health, but there are some, just as we've talked about, dark matter in the universe, to say that we know that there are things in the universe that we don't yet understand, and scientists are working hard to understand that. There are compounds in food as well that we have yet to understand. And so some people are using the term nutritional dark matter to describe that, which I think is apt. So let's acknowledge that it's there and keep learning why it matters, what it does. And
I think there's like upwards of 20,000 of them. So, but we're learning what they are, what they do. But again, I think from the perspective of, it's time to act, is that we will continue to learn about these things, but we also know enough that we can continue to move along on the journey while still learning about that nutritional dark matter.
Yeah, I think you mentioned in the paper, we'll probably never know exactly how nutrients in food affect human health, but it obviously doesn't mean we shouldn't act. Like, we know enough to act.
And there's been such an emphasis on what one nutrient does here, and let's extract that nutrient and assign a value to it, and then like put it into a pill and then give it to people. But we realize that when we eat a meal and we eat food with other foods, like, those things interact, and it's a much harder science to do, again, from that bidirectional perspective of we're eating many foods together, and what is our body ready and able to interact with. It becomes a very complex science, but at the end of the day, we're interested in the outcomes, and also we eat 3 times a day ish. And so eating, the relationship between food and health is a lifelong one. It's not as simple as just taking a pill.
Eric, you unmuted. Do you want to add something? And then we have a question from Annemarie.
No, I just pushed the wrong button.
Hey, Eric,
I bet Eric has plenty to say.
I'm pretty sure he does, but let's go to the question of Annemarie.
Absolutely.
Annemarie, please unmute yourself. I will spotlight you as well.
Yes.
And welcome.
Thank you for everything for now. I'm a farmer from northern Germany. And what I do basically every day is I see soils and I touch them. And I'm very interested in the discussion between organic versus non-organic, because I've seen many organic soils that I consider to be poorer in terms of what I think of their microbiotic, of their pH levels, etc., than many non-organic soils where regenerative practices are applied. So what are your findings? Is it more, so what would be your priority number 1 to summarize to make foods better? Is it really to reduce chemicals, or is it, because I know many regenerative practices like no tillage, they require, for example, the use of a lot less, but still a few chemicals. So what would be your takeaway message to summarize? Is it better to reduce chemicals, or is it better to look for other practices first?
Yeah. You go ahead.
You want to start? You want me to start?
You go ahead.
I mean, in a perfect world, and I'm not a farmer, regenerative organic, right? It's the best of both worlds. And I say that realizing that it's very hard and it's challenging, and there's no, flick of a switch that will enable farmers or consumers or these systems to be able to integrate kind of both what we'll call the practice-based system of organic, if you're using that word and you're putting on a package, it has to follow a very specific list of what you're doing, or more importantly, what you're not doing, what you're not spraying, what you're not, and regenerative, which is in many cases a system that is connected to practices that have outcomes. And so, I mean, I'm most interested in the outcomes perspective, both from the outcomes of the, soil and the soil microbiome, but, what happens once it gets to the person. And so I think that there has been this kind of this split between, really spending a lot of money on getting these conventional systems so that they produce the most quantity as possible, where we really need to be focused on moving towards a more quality-based system, and that we just haven't seen the investment, I would say, in specifically the technologies that would enable, when we start looking at weed control. I've seen some really cool things over the past couple of years, whether it relates to electro weeding or robotic sensors with optical sensors to kind of put walnut shells onto weeds. I think there's a lot of ways to do no-till without those, without the chemicals. Is that technology available yet? Have there been enough investment in that technology to make it widely accessible? No. And I think that's a great place to have, for this community to have that conversation.
Yeah, I would say you see examples of the systems without chemical inputs, without the practices without chemical inputs. It's definitely possible. It really depends, obviously, on the context, on the soil, on where the system comes from. But it's not by definition like no-till means chemical. I mean, in some cases, no-till, with some farmers, it means a lot of chemicals. With others, it means a lot of animal integration, and weeds are suppressed in different ways. And some I see the first robotics coming. I see the first cover crops coming, cover crop mixes. There's a lot of creativity there nobody wakes up in the morning and happily puts on the sprayer at the back of the tractor in front and starts spraying everything and needs to wear the suit, etc. So there's a lot of creativity, but there's a lot of investments and a lot of development needed there to make sure that even that last bit that might currently seems essential or seems needed and necessary to get it out. But I think that the different levels that David and Mandy showed before really shows that in terms of health. Yeah, what's worse? One spray every couple of years of very bad or non-healthy organic soils. We don't know. I think we don't know at the moment what's worse for our health or what's better. I mean, to ask the question differently.
I would underscore something that I think you're getting at, Anne-Marie, that I think is really important, which is to say that organic itself does not necessarily improve the nutrient qualities of the food. I think we as a movement haven't always been so great at describing that or talking about that. The absence of chemicals is really critical to human health, but the organic food is not necessarily more nutritious than conventional food, which is kind of a scary thought in many ways. So I think we have to keep grappling with that as a movement. So I appreciate you bringing up the discussion. Thank you.
Does that cover your question? Although obviously it doesn't answer it because there's no easy answer there. I see some other answers or some other response in the chat. Sorry, go ahead, Anne-Marie.
Oh, sorry. Yeah, I didn't expect an answer because I know this field is very, but it was my intention to, get the discussion going. And it's also, I think as a farmer, there are so many farmers out there, and I think we really need to look for something practical that is also for as many farmers, so that as many farmers as possible will apply these practices and regenerative practices. And sometimes, it's a challenge, but we'll get there. Yeah.
And then in the chat, that's where I put the importance of these social safety nets for farmers in particular, is that if the innovation is coming out of farmers trying new things, how do we make sure that those farmers have the right kind of protection if something doesn't work, that they don't lose the farm? And how do we make sure that again, we have to switch the way we're thinking about agriculture as it relates to everything else, in terms of just creating more from that quantity to what are the outcomes in which we're seeking. If we're seeking the delivery of phytonutrients and antioxidants, then that's a measure we're going to have to track and value as it relates to how we do agriculture.
Absolutely. Yeah. Any other? I see a strong discussion, not strong, an interesting discussion in the chat on organic as well. I mean, obviously, if you're in a place where it's not regulated and it's not a label and a relatively simple checklist, this is it or this is not, then organic can mean very different things. You're absolutely right. Any other questions around? I see John who switched on this video. That might be a question. Yeah, please unmute yourself and fire away.
Thank you very much. I wanted to just piggyback on meeting up with Anna Marie. I'm really delighted at being in a room with a farmer, with somebody who actually produces the stuff that we're having a conversation about. And I live in a city, a relatively small city in the UK. And I think the reason, thanks for saying hello, Anna Marie. I think those, for me, in terms of this whole discussion, what am I trying to say? I want to develop and improve the intimacy appropriately, the understanding, the relationship between those of us that consume the food that is produced, the vast majority of whom live in urban centres of one kind and another, to a greater or lesser extent, even down to a small town. And to a greater or lesser extent, we have very little sense at all in terms of our life experience of what it is, what the life is like, what's involved with people who produce food, who produce our food. And certainly because many of the people that we're talking about live way over the other side of the world, let alone just within Europe or something like that, speaking as somebody who is in the UK. So what I think I would like to see in the conversation, I don't mean necessarily today, but in general, is the development of an understanding, a relationship, a working relationship between consumers and people who produce. And one of the aspects of that, I feel, is this promotion of more local, emphasizing more and more locally produced. Local, of course, can be a whole range of what you mean by local. And I think at the bottom of that for me is re-establishing again my personal relationship to the food that I produce. And that's to do with my relationship with the people who produce my food. Thank you.
Thank you so much for beautifully said. And actually it triggered something in me on a question. You mentioned access to these type of foods in the report. And I remember we've done one interview, and I'm blanking on which one it was, but mainly focusing on getting organic food into the hands of people coming out of the hospital, especially lower income. And they saw the best results were of healthier food where people were normally weren't eating healthier food, especially after a health crisis coming out of a big operation, etc. Where can this have the biggest impact? Is that with the people that normally aren't, not the people probably that hear in the call that already are paying a lot of attention to their food and maybe have some marginal gains, etc., but not the biggest swoops? What is the access piece here? How do we make sure this doesn't become the next organic and is only accessible for the happy few that do read all the labels, have time to cook, have energy to cook, can pay the gas bills, etc., etc.?
Mm-hmm. Well, we've been working on a project over the past several months looking at that very question about access. And I think a lot of interventions are nibbling around the edges of the questions of access, where they are creating programs to subsidize healthier food, whether it's regeneratively grown or organic. And so they're subsidizing the gap between what it costs to produce that food right now and folks' income and poverty. That is a Band-Aid fix that only gets you so much, and it's hard to scale. Really the question, and David was referring to this earlier, there are fundamental questions, especially in the United States, about income inequality and race-based income inequality. And until we work on that, people will not have the funds to be able to access the food. But we also think that the economics right now make regeneratively grown food and organic food artificially high compared to the subsidies that we're putting into conventional agriculture. So there are just these big economic questions at play around access, of course. But the other thing that we've been talking a lot about is, even when people have enough money to buy foods, there are access questions that have to do with your ability to fight against the marketing that big agriculture and big food companies are putting your way all the time, and that are targeted racially, especially in the United States. So you have to, again, even if you have the money, you have to get yourself to fight against those messages in order to purchase the food. And there are questions of trauma that people experience, the trauma done to their bodies and their minds that put them in a state where they are craving or wanting certain kinds of foods as well. So in our minds, that the access question goes well beyond subsidizing the gap in price. What did I miss on that, David? What else would you add from our work this summer?
I think that one of the other frameworks that we didn't really talk about in the paper, but is around the idea of true cost accounting. And there's been a couple of studies since one in 2019 and one in 2021, one global, one US focus, and I'll put them both in the chat now, that really showed that the burden of agriculture, the cost burden of agriculture falls on the health community. Mm-hmm. And so, when we look at I think the question of who pays or who should pay, or how do we value regenerative health focused agriculture differently, we have to look at this economic balance. And I think that's when we start to look at either inviting the healthcare and public health sector into the regenerative agriculture conversation, which is something that which is one of the goals of writing this paper, but also when we look from a public policy perspective of how do we get public subsidies to shift so that we're not paying for food twice, paying for it once on the subsidy side and paying for it again when we see people in the hospital and through healthcare systems where they exist.
Yeah, absolutely crucial discussion. We hope to have somebody of True Price and True Cost who made the underlying framework that the Rockefeller study used on the podcast soon to dive deep into that. And it's very interesting because that study found, I think it was 3x. So what we pay for food in the US, we have to 3x it, or what the actual costs are in terms of environmental, health, and societal. And obviously that was still undercut. So there's at least 3x, which is,
and there's a lot of things that we don't value, so that whatever those numbers, the numbers in both those studies are wildly conservative.
Yeah, so you can do it at least 3x, probably 10x, and the costs of the food system are just enormous. We have a few more minutes. I want to make sure we have space for a few more questions. I see some interesting discussions. Thank you, David, for putting stuff in the chat and remembering which interviews we did when. Eric, you want to come in?
Yeah, so I think on this healthcare topic, there are some promising activities, at least on a regional level. I know here in Minneapolis, for example, Blue Cross Blue Shield of Minnesota has been doing some outcomes-based work with a few of the healthcare providers. So, the traditional, again, in the US, the traditional health insurance response is to compensate for procedures, quite frankly. And so the medical system has been all about sick care because they can test and test and test and get paid for it. And these outcome-based programs are meant to, just like they sound, measure success based on the health of the individuals going through the system, not the number of tests that you performed on them. And part of that is the food program. So, upgrading the food program in general in the healthcare system, but specifically for vulnerable folks who either are heading into or coming out of some sort of medical situation. The early evidence is very promising, and I would expect to see that scale actually pretty quickly if some of these programs are successful, because everybody does better. Everybody does better in these programs. There's no losers in these programs,
which is rare in these kind of systems. Yeah. So I think it's interesting. As soon as we enter that healthcare part, like you enter whole different pockets of money, pockets of flows, and pain in the sense that's obviously real pain, but also pain that is being paid by insurance companies, by all of us at the end, that are just mind-bogglingly large. Like it's crazy to think about.
I was going to add in the conversation about access too. I think sometimes in these conversations about who eats badly, we too often slip into thinking it's just people living in poverty that make these choices. But I look around me and my community, and it's all kinds of people that are eating processed foods, or they have the resources, but they're still looking to pay as little as possible for their food. And so there are just these broader mindsets and narratives that we have about food and its connections to health. And I think, like Eric's talking about, if we get healthcare more into these conversations and help people start to understand what it actually means for our lives to eat healthy, and as other people were beautifully saying, to understand what it is to grow food and why that all matters, I think it will start to shift our understanding, and more people will transform their behaviors. So.
And then is it enough that, like, let's say a healthcare provider or an insurance company comes in and now they're saying, okay, you should walk at least 10,000 steps, which came from the Japanese for the signal of 10,000 steps, seems like a walking man. So it's completely not connected to science, but okay. But is it enough to say level 1 or 2, like replacement or get enough veggies, or should we immediately hit level 3 and level 4? Because otherwise maybe people don't even get better if they don't buy a broccoli that's not full of chemicals. Like what should we strive for to hit the home run and go to level 3 and maybe even the fermentation level 4? Or
I think there's still a ton of work to be done on level 1. I think there's tons and tons of work, but that doesn't mean that we should say, I think sometimes we get some critiques from people who are like, how dare you be talking about level 3 when so many people are struggling with level 1? And I think we need to be caring about all of it, and work of like the Bionutrient Food Association, where Eric works, and I spent some time supporting them this summer. We need to be doing that leading edge research to bring us all along and improve our healthcare systems and improve our farming and nutrition all along the way. So it's all really important. But I think Glenn just made a point in the chat there about how very, very powerful industry is on all of this, that make us think, no, don't look at what we're doing as an industry. Just walk your 10,000 steps. Just, if you weren't so lazy, if you ate a little bit healthier, you wouldn't have these health problems, really deflecting us from what industry is doing and the systemic issues at play. And we as a movement cannot lose our attention to that as well.
And that's where we've seen, I think, examples drawn from the tobacco litigation and from, I think, especially what's going on right now as we speak with Roundup and some of that litigation, of being able to connect some of these dots between some of the ways in which the industry, sections of the industry are working, and these outcomes, and where there are tools and strategies that help to, if anything, surface these stories and these connections, and work on that, I would say, toward a pathway toward mitigation.
I think with that, we're on top of the hour. We only scratch the surface like we always do, but that's good. So I would invite everyone to obviously read the white paper, dig into all of the 250 citations there, dig into the work of the Bionutrient Food Association, dig into the work of Bezos Harvest, and dig into the work of other people here and things that have been shared in the chat. I will definitely put the things of the chat into the show notes, so you can click on everything. Don't worry, we don't lose them. And get in touch with David and Mandy as well if you have follow-up questions. And I'm very much looking forward to the follow-up pieces, whatever shape or form they will take. The investment side of things is obviously super interesting to us and this community, and anything else around food as medicine, if we ever can call that, and the complexity around it is of great interest. So thank you so much for your work. And thank you so much for coming this early morning and sharing about it with our community.
Yeah, thank you for the opportunity. This is a great conversation.
Thanks for having us.
Thank you all.